everyone. I'm Prof. Jamuna Vadivelu from Merdu at the Faculty of Medicine here. This morning, I have great privilege to introduce, I should say, the latest recruit in Merdu, Professor David O'Regan. Professor David joined us a few months ago. His previous positions has been a consultant cardiothoracic surgeon at Leeds Teaching Hospital Trust. He has also been visiting professor at Imperial College. He has been director of the Faculty of Surgical Trainers at the Royal College of Surgeons, Edinburgh. His personal statement, or rather his vision in terms of academia, is he's creative and passionate educator, striving to inspire excellence in trainees and trainees on an international platform with patient outcomes at the forefront of endeavors. So this morning, I'd like David to inspire all of you with his talk entitled Inspire. Over to you, David.
Thank you very much indeed, Prof. Jamuna. It's a privilege to be able to talk to you today at the breakfast meeting. Salamat Beki. I've only been in the faculty for 3 months, and I feel at home. And I'd like to extend a big thank you to the wonderful colleagues that I've met, especially those in Merdu. I might have many degrees, but the 2 degrees that I'm most proud of, notwithstanding the age at which I attained them, are my 2nd Dan in Iaido and 3rd Dan in karate. And I joined the Japanese club here in Kuala Lumpur to continue my studies in Iaido. My sensei is 4th Dan, and I realize that despite my qualification, I have a lot to learn. And learning is lifetime. It took me 15 years to become a consultant cardiothoracic surgeon in the UK, including 2 years as a Doctor of Medicine at the Thrombosis Research Institute in London. And I can honestly say that I was trained by the good, the bad, and the ugly. Fortunately, the culture of surgical training is changing, but there's yet a lot to do, and there are a lot of lessons to be had. I was president of the Association of Surgeons in Training of Great Britain and Ireland in 1999-2000, and I instigated and established the Silver Scalpel Award to identify the best surgical trainer of the land. Because I believed then, as I believe now, you can have the most innovative training program you like, but it's not going to go anywhere without a good teacher. The Silver Scalpel Award shown here is literally a scalpel plated in silver, courtesy of Swan & Morton, mounted in an acrylic block on an oak plinth. It doesn't carry any financial reward, but it's now become the most coveted training award in the United Kingdom. If you want to know who is a good teacher, and I'll ask the audience, you ask the student, and you will all remember your good teachers. So the award is a 4-stage judging process. We invited the trainees to reflect on their trainers in 4 categories: leadership, resourcefulness, trainee development, communication, and professionalism. The top score is to 2 decimal points, and usually the 5 or 6 top entries scored on a template that was designed by educational psychologists and industrial psychologists is usually above 3.55 out of 7. Those people undergo a 360-degree assessment where trainees in pairs interview the trainer, a peer, other trainees, a sister. And I write to the medical director, the chief executive, and the postgraduate dean to ask if there's any reason why these people could not progress with the award. The results of the interviews are redacted, and summarized and sent to the presidents of 4 colleges, including a patient representative, and they rank them. I apply another formula to determine the top 3 and send that to the highest ranking person in the NHS. At the time, it was the medical director, Professor Liam Donaldson, and I continue to use Professor Sir Bruce Keogh. And I did this deliberately because I felt it was important that the system acknowledges and recognizes the importance of a good trainer. So what did we learn from these people? Are they any different to you and me? So we took 30 of them and put them through tests and asked them to do online 16 PF personality tests, focused on reflective writing, and ran a 1-day workshop with psychologists and other trainees. It would not surprise you that these people are no different. And actually, if you look at the scores, they might be slightly more abstract in their thinking and perhaps more emotionally stable. Not surprising, they're perhaps more trusting, more grounded, open to change, and more relaxed. But nothing stands out. In the common characteristics, they are able to attend to the trainees' needs. They're firm but fair, and they also address interpersonal development. From the common behaviors, they're able to adapt their own styles to suit the trainees' needs and provide honest feedback. They can be tough. They're very good at reflective dialogue and feedback, and very good with time and thought. But most of these behaviors can actually be learned and practiced. And effective trainers make time and build time into their normal working day for trainees. They adapt their styles, they clarify expectations, they give good feedback and appropriate by defining the roles and respecting the person. They know when to coach and when to mentor. They can confront problems, and they themselves continually seek improvement. What is interesting, I think, about teaching medical school is we're not just teaching a student, because involved in this is the patient in front of you today, and the patient in front of the student tomorrow. And there's learning going on between the patient, the teacher, and the learner. And this is a triad of learning, an engine that drives. What is interesting, the common theme that came out of 23 years of running the award, and we're just about to run it again, is that good service goes hand in hand. Training does not mean you do not deliver the service. On the contrary. And putting my MBA hat on, I've used Michael Porter's value chain to represent this interdependency. Ability, capability, and competency of the trainee is echoed by satisfaction, reputation, and recommendation of the trainer. At the forefront of all of this is the quality of the delivery of the service over the cost, being the time, convenience, access. The oil that runs this engine is respect, trust, and confidence. And there are a lot of interdependencies in this. From a trainee perspective, the quality of the environment, the encounter, the information. From the trainer perspective, the perception of the leadership, organization, and competencies. And of course, from the patient added value, is improved access, volume, service, and improved safety and satisfaction. So this is the cyclotron of people, learning, and environment. And this actually sits within the structure, strategy, and systems of a learning organization and drives improvement in quality. I was very interested to listen to Prof. Young's talk last week, where she referred to Maslow's needs. There's more than one self, and this is appreciated in Eastern cultures. We have multiple selves. But if you apply Maslow's needs to the self, the learner, the teacher environment, you'll recognize that there are deficient needs, the related needs of love, trust, dedication, and teamwork are all part of the interactions in the hospital and the learning environment. And it's only when these are met are the worth needs expressed. I had a conversation with Edgar Schein, who is the cultural guru and professor at MIT, and he summed it up very similarly. Attitude plus behaviors equals culture. An organization needs to hire attitude, coach and role model behaviors, and then you have culture. But I firmly believe teaching is a privilege, is not a right. And you need to earn that. And I also believe that the attributes of a good teacher are undervalued. They're cognitive and non-cognitive attributes. And some of these are difficult to define. But very simply, you ask the student. And in the chat room, I'd like you to put some adjectives down that would describe what you understand by a good teacher. Because it's not what we teach, it's how we teach. And teachers teach more by what they are than what they say. And teaching is from the heart. It's an emotional connection. They say the longest journey is from the head to the heart. The essence of teaching is around the high support, high trust quadrant in this diagram. We need to be operating in that area, reflecting on our relationships, respecting people, offering constructive challenge. And there's a mutual learning in this. The symbol of the plant in the light bulb is it means that this is fragile. But we all understand the term learning with, because many of us are parents, leaders, and teachers, where this with of high support and high trust is the optimal learning area. I put it to you, you teach more with the heart than emotional intelligence or knowledge or IQ. I'm delighted to read such positive feedback from the students of the Faculty of Medicine at the University of Malaya. And you can see yourself some of the words on this word cloud of dedicated, passionate, explaining, knowledgeable. It is all there. Similarly, with the clinical students, encouraging, willing, constructive, knowledgeable. And these words, not surprisingly, reflect the words of the word cloud of the Silver Scalpel Award. I'm delighted when I chat to the students that they are scoring the syllabus between 7 and 8.5 out of 10. But what will it take to make it 10 out of 10? And that's why we are proposing the Inspire program. because teaching is inspiring. It's not what you teach, it is how you teach. And everyone has potential. So we're looking to a program that is going to identify and support good teachers, to bolster the frontline faculty, to nurture, grow, and develop good teachers, to develop role models, disseminate and apply educational theory, and establish clinical milestones and develop a faculty, with the aim of generating a learning organization. As I said, it's not what that is important anymore, because that's available on your mobile phone, on the blackboard, and in a slide. It's the how and the why to get and generate self-awareness, reflection, and lifelong learning. So what do we need to do to develop our teaching competence? And do we have quality controls and performance indicators in place? What do we need to actually measure, and how can we collect the data? And this is part of our initiative. In essence, the system must recognize, believe, invest in the teacher if it's to be a learning system. If we develop the teachers and grow their competencies, the rest will follow. The return on investment is infinite. And I'd like to borrow the quote from Nelson Mandela. He said, education, education, education. But when you combine a good heart and a good head, an informed teacher, you're going to have something very special. Thank you very much indeed.
Thank you very much, David, for that inspirational talk. There are some comments and chats. I can't seem to get it. Just give me a minute. Okay. So there's a question from Prof. Chan Yu Quen. She says, I'm already inspired by you, Prof. David. Are you likely to start the program here at the faculty?
The answer to that is definitely. I feel that the soil is very fertile, that the faculty in Merdu have a lot of tools in place, and we can use these tools that are already in place to enrich the environment by growing our teachers. I think the best teachers will inspire the students and improve the reputation. And I would like to ask the system to look at the issues of training from the direction and focus on the trainer and the teacher. The rest will follow.
Okay, another comment from Professor Tungusara. She says, patient, you need to be interested in people and patience with them. How would you like to respond to that comment?
I'm sorry, I missed that.
Her comment was, we have to think of the patient, and you need to be interested in people and the patients.
Exactly. And that is the cyclotron of the patient, the learner, and the teacher. As part of that development, you're learning as much from the patient and from the trainee. And a good teachers exhibit humility and fallibility and are willing to learn from both. And involving the patient in that learning process engenders trust and respect and empowers them in making decisions about their own health and well-being. That is important. I note that you do have a Golden Scalpel and Golden Fusion Awards mentioned here. Indeed, you have lots of tools available at present, and the Inspire program is there to connect this all. And I've had a pleasure chatting to many clinical and preclinical faculty who are likewise enthusiastic in developing this further.
Okay. I think we should think about this golden infusion, definitely.
I like that idea.
Yeah, including a golden lanyard. Perhaps you'd like to elaborate on that?
Well, it's very simple, Prof. Jamuna, that we need to recognize and value our good teachers. Do we know who they are? The Silver Scalpel Award is a simple token or gesture, and I would like to see a recognition system that we offer our gold lanyard to our clinical and preclinical staff who have been identified by the trainees as being outstanding teachers. We do have a lot of information, but we need to feedback that to the trainers, and we could grow the system of recognition. I think what is missing in many organizations is the principles of positive deviance. Despite the restrictions on context, time, and space, there are individuals out there that still deliver exemplary, outstanding, and inspirational training. The question is, how and why can they do it? What makes them different? And as I've already alluded to, it's not much at all, but it's a different way of thinking. But it needs to start with the whole system recognizing the importance. This is from the top down, the dean, the director of the hospital, and all the department heads. Together, we can go far.
Great. I think we need to think about putting these things in place. There's another comment, question from an anonymous attendee. Do you have any advice to those who don't view themselves as formal trainers, as in outside of an academic setting?
I don't think you necessarily need to be identified as a formal trainer. As an individual, and your learnt experience can be shared. And what is necessary when delivering a lecture or delivering teaching is tap in to that learnt experience. You are you. There's no one else in the world more you than you, as Dr. Jus would say. By tapping in to your own lived experience and sharing what you learned, should have learned, could have learned better, is a good way of starting. It demonstrates the fallibility, your humility, the willingness to continue learning. And you have to remember that learning is bidirectional. You don't have to know it. You just have to inspire. You have to listen, create space and time for the person to come up with the answers. Indeed, I've learned over my 23 years of being a consultant and teacher, you learn more from your trainees than you do by giving them. And what you need to do is share your knowledge. And as Homo sapiens, we are driven by stories. You will have stories. Share those stories. It answers the why, and people are captivated by stories. And all modern presentations actually invite you to consider delivering stories, not delivering lectures, because that answers the how and the why. So the question there is, are teachers born or made? I think everybody has potential, as in the strapline of Inspire. You might not think you're a good teacher, but if we find positive deviants and you go and chat to them, you might learn tips and tricks and suddenly realize your potential, and you will become a good teacher yourself.
Okay, there are more questions. Prof. Sarah, this recording will be available, I think, through UMHealth. So I think you'll be able to get that. Another question, some new universities in Malaysia award professorships without much academic achievement. What is your comment?
Thank you very, very much for that question. In my mind, the professors of yesteryear used to be the matriarchs or patriarchs of the department that not only looked after the academic and education, but they looked after the welfare of the team. As time has gone by, the universities and academic institutions, unfortunately and understandably, judge the success of a professor by papers, academic achievement, grants, and they all feed KPIs. I can understand that because that is easy to measure. But what has been lost during this is the long-term value creation of education that is difficult to quantify. The ability to inspire the next generation and affect how they deliver care for future patients is what we are about. And I do think we should have professors in education in every hospital, in every specialty around the world. But that is not a professor by appointment alone. They must have a modicum of educational theory and experience in actually delivering and teaching in multiple. It's practiced, it's learned, and it's role modeled. And that's what we want to do with the Inspire program. And it's one element that many people are a little bit hesitant to address is when something has not gone quite right. And you can imagine in cardiac surgery, when you're operating the table, if something doesn't go quite right, the implications are very high. But then you have to think, what have you done to prepare for that moment, and how do you prepare the person? But we also have got to remember is that when you fail, we learn more from failing. And what we don't recognize in health and in education, that failure offers a learning opportunity, is not there for criticism.
I think we have time for one or two questions from the anonymous attendee is, what are your thoughts on some people claiming to be better teachers than others? How to prevent this toxic ideation within the fraternity? And to add on to that, the difference between a mentor and a coach.
Right. So you're only as good as your last lecture. And if you really want to understand and how good you are, why don't you ask the students? And the other thing is from a simple point of view, if you create a Likert scale, you should count 5 out of 5 only. Because 5 out of 5 is the aha, that emotional connection that you've made, that inspiration. The difference between 5 out of 5 and 4 out of 5 in customer service, for example, is a 75% reduction in footfall. And the only company on the planet that lives and survives on 5 out of 5 is Disney. Because if they didn't get 5 out of 5 each and every time, people wouldn't return. One of my students actually played Goofy in Disneyland in Los Angeles, and they're not allowed to speak. And their communication is all nonverbal. And Disneyland trains people to look and behave happy. And if you can't make it, fake it. And we can teach you to do that. I'll give you something funny. If you're feeling glum during the day, put a pencil in your mouth simply by stretching all your facial muscles. It actually sends signal to your brain and you feel enlightened. Not only that, the people around you will laugh, but it did amuse me. Coaching and mentoring is a complex thing. Simply The coaching is, from a sporting point of view, addressing technique and development of skills. The mentoring is inviting the student to find themselves, to look for self-reflection, to seek answers within themselves for development. But I agree, the two are often used synonymously and often incorrectly. And there's a lot more to that than meets the eye.
Thank you very much. And I think we're time's up. Thank you very much for the inspirational talk. And thank you for everyone attending this breakfast at UMHealth. And with that, we take leave now. Thank you and have a good day.